There's another complication of pregnancy, which is hypertension. All right. So you get to see that some women, when they were without pregnancy, there was no hypertension. But after they got pregnant, then hypertension actually set in. Okay, so we'll get to actually look at this concept and see what actually causes this hypertension in pregnancy. Okay, so look at it under different headings, from the definition to the types to the causes to the symptoms to the diagnosis and possible complications that could result from hypertension in pregnancy. All right, so from the definition, we have it that this hypertension in pregnancy is a condition which is characterized by what? Elevated blood pressures. And these blood pressures are elevated during pregnancy, okay? And this will affect about what? 5 to 10% of pregnancies, okay? So what are the types of this hypertension in pregnancy? We have the gestational hypertension, where you're having new onset hypertension after 20 weeks, okay, of gestation. Then we have the chronic hypertension. This one is um, you had hypertension even before getting pregnant. But the thing is, pregnancy will now make it worse to get. All right. Then we have the preeclampsia or hypertension, where this one is hypertension with proteinuria or end organ damage. All right. So what are the causes which everybody would like to always know? What are the causes um, for hypertension in pregnancy? It could be placental dysfunction. It could be genetic factors. It could be pre-existing medical conditions. Like some people must have had kidney disease, must have had diabetes. Do you understand? Must have already have another underlying condition, right? So it's just like pregnancy now made it worse, right? There are multiple gestations, like you have given birth many times, right? The obesity too, right? Pregnant women obese, that could be a predisposing factor for hypertension in pregnancy too. So what are the symptoms? What is the mother likely to complain about? So she can complain about severe headache, then she might complain about vision changes, like they're having blind spots, double vision and all that. She might complain about she wants to vomit, okay? Then abdominal pain, then shortness of breath, okay? So how can you be able to diagnose? Of course, you monitor her pressure, you test her urine to see if there's what proteins in the urine, that's what proteinuria. Then you also monitor the fetus, okay, using ultrasound and the rest, okay. Complications, this could lead to what? Preeclampsia. It could lead to eclampsia, that's basically seizures. So preeclampsia is like seizure like stops, okay. So seizures, the mother might actually develop seizures. It can lead to what? Placenta abruption, a cut in the placenta. It could lead to the mother giving birth before the normal 9 months that we know. Okay, so they will give birth to premature babies. Okay, then low birth weight, then maternal stroke or cardiac arrest. Okay, so management, if you want to manage a woman that have this hypertension in pregnancy, you just monitor their blood pressure and the fetus well-being. You give them bed rest and activity restriction, then antihypertensive medication, corticosteroid for fetal lung maturity. Okay, that's if it is likely that the woman will give birth before the normal 9 months that we know. Okay, then delivery could be vaginal or cesarean, okay, which should be determined by the physician in charge. So that's it for what hypertension in pregnancy.